Victorian Health Minister visited a regional hospital in Colac and found that it was very, very busy. I mean, when the Health Minister entered the waiting area, there were 10 patients all waiting to be seen. There was a patient being triaged from the ambulance into a hospital bed, the patient not in good shape, but there were hospital staff attending to this person. And it was only when the Health Minister left that someone reported that none of these patients were real. They were all staff pretending to be patients. In fact, some of the hospital staff had called family and friends and asked them to come in and act as if they were patients as well. It was all, of course, designed to demonstrate just how busy they were and how much in need of government funding they really were. Now, there's been a big inquiry into this, and the Department of Health have found that, yes, that was a pantomime. They were not real patients. And more than that, there was a possibility that patient care, it wasn't, but it could have been impacted by the fact that medical staff were pretending rather than attending to patients. Liz, can you believe this stuff?
This is just incredible. I mean, when you want more government funding, it doesn't do to be deserted on the day that the Minister for Health and the ambulance services is rocking up to your little... What's this place called? We've got a name and shame here.
This is the Colac Area Health.
Colac Area Health.
Colac is awesome, actually. It's got the best
Colac Area Health
in the country. We used to stop there on our way to Apollo Bay.
If you ever go there and it seems busy and you're not getting service on time, just remember this story, because you don't know whether those people are legit or not.
On the other hand, if you're an aspiring actor or actress, don't go to Hollywood, go to Colac and you'll get a role. Listen
it
to this.
Wasn't a paid gig,
The chief executive of Colac Health said, quote, "We're committed to learning from this incident." What would they learn, Joe? I guess they'd learn, rather than playing doctors and nurses, they should actually be doctors and nurses. But then it says this: "We're committed to providing better service." I think by which they mean actual service.
This is the thing.
Yeah.
Like, the whole state of Victoria is the Truman Show. It turned out that none of it's real. Like, everything that the government said, again, when Dan Andrews got up there and said, we're being tougher on COVID than anyone else, they were pissing it out the door. Literally. They were just opening the doors to hotel quarantine. Oh, I don't need to wear a mask. No, that's fine. How are we going to staff this thing? Oh, no, let's just put out a thing and just see who, anyone who's unemployable anywhere else, will get them to be in Victoria's front line against this disease that we're telling everyone is going to kill you all, right? So it's just amazing. And they're just gaslighting people. They are gaslighting everybody. And now we get to the point when the minister visits a hospital, right, this is a state where there are actual real ramping problems, real ambulance problems, real shortages in real emergency departments in real hospitals, right? And then the minister comes, they actually pretend that they've got an emergency because it's the one place they don't have one. And so we get to the point where the people of Victoria are now gaslighting the government back. This just could not get any more insane.
And once
again, the government's created a closed loop where it's now gaslighting itself.
And once again, there is absolutely no accountability.
No, because every time they have an inquiry, no one's ever in charge. There's never a person. It's just the system. And again, hotel quarantine. They found that no one was in charge of the most important thing, the most deadly disease that they, the government, were telling us to shit ourselves over.
Yeah, well, let's talk about that.